Hi, Nick. Thank you
Hi,
very much for uh, fitting in the last minute.
thank you.
And just for our viewers, I wanted to mention one of our candidates couldn't make it at the last minute due to some unforeseen circumstances,
hmm
and you kindly agreed to come in
Yeah,
because I believe your story is quite similar to the rest of the
some
candidates.
of them, yeah.
So yeah, thank you very much. To begin with, uh, as I asked this question to other candidates, I would ask to yourself as well. Even though it's last minute, what prompted you to come in and fit in at the last minute, agreeing you to be a part of this podcast as a candidate rather than as a part of the team?
um, I think it's very important to talk about it and highlight it, just
Hmm.
so as it gets the awareness out there.
Excellent.
I don't mind sharing my story.
Excellent. When you mentioned highlighted, you mentioned to say the screening program, the awareness regarding.
Yes, absolutely. I've recently just, although my journey was breast cancer, I've just recently had my call for cervical
Hmm.
screening a couple of weeks ago, which I attended, and I've just had through the NHS app on my phone the results, which are all clear. So I'm pleased with that.
Excellent.
So that was quite quick.
Glad to know that. And then let's touch base on your experience regarding your smear, the cervical screening, right?
Yep.
Tell me a little bit more. How was the experience, and a little bit more for our audience? What's the whole process like?
It was quite quick in terms of the appointment being booked at the surgery where
Hmm.
I'm from, and the nurse saw me quite quickly on appointment. She relaxed me. She was quite calm. She talked me through the procedure.
Hmm.
It was personal, obviously, but she, how can I say, she respected privacy, gave me time
Excellent.
to relax, taught me through the procedure as she was doing it, um, and it was straightforward.
And how long did it take, roughly?
A couple of minutes.
I see. And how was the procedure in itself? Any discomfort, or it's
A
quite?
little bit of discomfort, but I think that's just me perhaps tensing up,
I see.
nervous, and I don't think anybody can not be nervous with it.
I see.
It's a procedure, so it's you're just going to be a little bit more,
I see.
if you know what I mean.
Right. And well, thank you. I'm sure that people will find it quite informative for themselves when they come for the screening. And when you opted for the screening, when you got a recall, was it an invitation where you send a message or a letter?
I had an email through off the NHS telling me that I was due for screening. So
Hmm.
obviously I'd gone because I think it's now 5 years and not 3 years that you
Hmm.
go for the screening. So I booked it straight away there and then that week. I didn't need to wait. I thought I would have to wait a week and I didn't. And got seen quite quickly on the appointment. So I was pleased with that. And
And
then the results have come through as I've been sitting here today with the result through on the NHS app. So I've logged into that, had a look, and it said everything was negative. So I'm quite pleased.
excellent.
So I haven't got to chase it up with the GP or anything.
Indeed reassuring, isn't it?
Reassuring, so you're not left lingering.
Good, because the whole process seems to be quite straightforward and
Yeah,
doesn't take long, right?
yeah, more organised, especially through the app. And I'm not really very good with apps. I'm a bit of a dinosaur when it comes to them. So I was pleased I managed to navigate that all right.
Excellent, excellent. As we know that you have had a previous history of the breast cancer,
Yes.
am I correct? So
Yeah,
that would have uh, seriously for you to consider that you need to go for the screening.
absolutely.
Apart from that, was any other reasons that you wanted to go? Obviously, different people get motivated by different reasons to go for these screening programs, and some don't. What's your message to those people?
Oh, that's a good question. Um, I think the earlier you find something, the better the outcome is. For
Hmm.
me, it certainly was. It was caught very, very early
I see.
in terms of the breast cancer, and I just think you've got every fighting chance then.
I see. Well, firstly, thank you for taking us through the screening program for the cervical cancer. The cervical screening.
Yeah.
And, and and if you don't mind, just tell us a little bit more about the journey with how your breast cancer.
The breast cancer, I was 47, so I
Hmm.
wasn't called for the mammograms because that's over 50s. Um, I'd come back from a long haul flight, Dominican or Mexican, and got pain in the back here, couldn't breathe, felt like I was gasping a little bit. Cut a long story short, ended up at A&E that weekend because it didn't seem to go, and I used to go running twice a week. I've never smoked, only have a couple of drinks at a weekend under the threshold of the NHS guidelines. So I considered myself slim, fit and healthy. Do you know what I mean? So couldn't understand why I got this pain. The out of hours sent me through to A&E. A&E put me through the what I call as the giant donut in the A&E. That threw up multiple blood clots in both lungs, which absolutely surprised us. We didn't expect that, and I didn't know where they'd come from.
I see. So you traveled.
Yeah.
Began with a pain on the right side.
Yeah, at the back in the flank there.
I see.
Yeah.
That led to the admission to hospital.
Yeah.
And you had a scan.
Yeah.
To check whether there's a blood clot.
Yeah.
Because of the travel
well,
history.
They kept looking at my legs. I think they were looking for deep vein thrombosis, and there was nothing wrong. There was no pain, no swelling, no nothing.
I see.
It was all here.
I see. So that confirmed the blood clots.
Yes.
And that's when the treatment started for the blood clots.
Yeah.
And then what happened next?
So they kept me in, sent me for the 3 tests, which are within the NICE guidelines, one of which was a mammogram. Went for the mammogram, and that picked up very, very minute tumours, if you like, 0.3 of a mil, 0.1 of a mil, to the point where when I've had the lumpectomy, they've had to put markers in, titanium markers, because they were that small.
I see. So admission led to a scan.
Yeah.
That found a blood clot.
Yeah.
Just for the audience, when a person who's of younger age and they get a blood clot.
Yeah, so immediately you have an injection in your stomach to start breaking it down, and then I was put on a Pixaban for 12 months. Hematology were happy that the body knew that cancer was forming and there wasn't anything else underlying, so I came off that tablet after 12 months.
I see. So that I'm getting it right.
Yes.
Basically, you were diagnosed with a blood clot.
Yeah.
You were fit and well.
Yeah.
There was no obvious reason for you to develop
No,
a blood clot.
absolutely none. I went running twice a week.
And when we look at that scenario, and when people develop blood clot without a reason, especially when they're younger,
yes,
there could be underlying something going on, and one of the reasons could be cancer.
Yeah.
And that prompted for you to have certain investigation that included a mammogram.
I did, yes.
And
it led on to biopsies, and then obviously.
So at the point when you had the mammogram, you were not having any breast lumps, any breast
No, I got
symptoms.
no lump, no nothing.
So from that point of view, you were completely asymptomatic. You're fine. You are not
absolutely fine.
I see. So it was a blessing in disguise.
Yeah, the blood clot saved my life, actually.
Isn't it?
That's how I look at it, because that's how they've.
One thing led to the other.
Yeah.
But eventually it was the mammogram which picked it
up.
At a point where you were not having any breast cancer related symptoms.
Nothing, no symptoms, no lumps, nipple was fine, nothing had changed visually, no lumps at all, no symptoms.
Must have been a difficult time at the time.
Yeah, when I thought I was fit and healthy, and then that comes and it's like I've been run over by a bus.
It came from nowhere.
Yes.
One moment you're on a holiday somewhere, and the next moment we're having to dealing with the biggest issue of our life, isn't it?
Yeah.
Which can probably change things for the rest of our life.
It has, yeah, because you look at things differently.
I see. And how was the family coping with this?
I think I coped better than my husband did. He found it difficult, and it wasn't his body.
And Nick, how was the support system? Was it in place in terms of support from the community, from the clinicians, or the healthcare?
The surgeon wasn't just a breast cancer surgeon, he was actually a plastic surgeon as well. So he's made it, my lumpectomy's here. So I only needed radiotherapy, which was absolutely nothing at all to worry about. It takes you longer to take your clothes off than it does to get on the bed and have the radiotherapy targeted at your area, your bust or wherever it is. The team were amazing. The breast team were amazing. You felt part of their family, if that makes sense.
I see.
You felt like they got their arms around you and you got that safety net.
I see. You didn't feel alone in the journey.
No, no, not at all.
I'm glad
No,
to know that.
no.
And now, when you look back at this whole journey, and you see, there are, obviously, anything you do, there are positives, and there are not so many positives. So, what is that you would probably, look at this, and what do you make out of it, the entire journey, particularly?
I'm a positive person, and I think I tell people I don't clam up and not tell somebody that I've had breast cancer because I'm not embarrassed by it. And I just think, if you find something the earliest you can possibly find it, you've got the best possible outcome and chance in life. And my journey was 9 years ago. So to me, I wouldn't be here for my granddaughter that I've got. I'm going to get upset now.
Sorry about that. Take your time.
Yeah. So I wouldn't be Nanny.
And as you correctly say about the screening program, and that's one of the reasons, you mentioned it was at the age of 50 at the time. If I'm not mistaken, it was expected to be changed to from the age of 47 now.
Oh, good.
The whole idea is to detect, these cancers,
Yeah.
which is breast cancers in this case, at an early stage whereby patients may not have any symptoms.
Yeah.
And now, the screening program, you explain how straightforward it is, doesn't take long, and how much difference it can make in one's life. What would you say to the people who are listening to yourself regarding this, screening program? What would your message be to those people?
Keep getting checked up. If you're sent an invitation, go. There's nothing to be frightened of.
I see. And
life's worth living.
Absolutely. And different people do get this news differently. Some people like to share it, and others want to keep it to themselves.
Private, I quite understand that. They're nervous. They might not have that network of support or somebody that they can talk to. I work as part of my job with the learning disability patients as well, and sometimes they haven't got a network, so I will support them on a hospital visit or a cancer visit so that they've got somebody. I was lucky enough to have my mum with me on my journey. She came to every appointment with me, and that must have been frightening for her that she could, in her eyes, obviously lose a daughter, and I'm an only one, so.
I can imagine. And Nick, you came here. I really appreciate that. You expressed, you shared your experience. What does this mean to yourself, having come here and sharing your experience with the wider community of Stoke-on-Trent and beyond?
I'm just proud of the job that I do because it allows me to meet new people. The patients that we've met today have been amazing, and I've made new friends.
True.
There's been some lovely characters that have come through that door and shared things with me, and obviously I've shared my journey with them, and I've been quite open with them.
Likewise.
Yeah.
Had they not opted for the screening, probably outcome may have been.
Oh yeah, could have been a lot different.
Different, right?
Yeah.
So
yeah.
Probably whoever is watching yourself today, your message will be, I would imagine,
definitely, please go for your screening. Definitely.
Well, thank you very much,
No,
Nick.
thank
You've
you.
been really, really, helpful with this. Really appreciate.